Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Hey everyone, welcome back to Research Perch. We're glad you're joining us today. I'm Michael Reynolds, the chair of the Massage Therapy Foundation Marketing Committee, and here as always with Niki Munk and Ruth Werner. Niki, you're joining us from your office in Indianapolis, it looks like. How are you?
I'm doing great. Thanks, Michael.
Awesome. Ruth, you're from your home in Oregon today.
Oh, as always.
As always. I love seeing the scenery in the background. It just makes me want to get to the coast.
I'll tip my computer to look out the window.
Oh, please, yes. All right, so as you know, Research Perch unpacks articles from the International Journal of Therapeutic Massage and Bodywork online at ijtmb.org, and we all hope that you're subscribing by now since we've been banging that drum for a while. If not, please go subscribe. It is free, and it is full of great articles on massage therapy research that can help you in your practice. So today, we are doing something a little bit different. This article is a bit different than what we usually talk about. It's by Karen Boulanger, and it's our personal characteristics of massage therapists associated with their clinical, educational, and interpersonal behaviors. And I'm just gonna read the first paragraph in the abstract here, and then Niki, I'm gonna ask you to kind of play that back to me in a simpler format because it still makes my head hurt a little bit. So it starts off saying, social cognitive theory, that's where I get lost already, suggests that characteristics of health professionals, such as their beliefs in the effectiveness of their care, influence their behavior. Studying the characteristics of massage therapists may therefore provide insight into their clinical, educational, and interpersonal behavior, which ultimately affects their client interactions. Whew, okay, Niki, tell me what that means.
All right. Well, first, this is a really nice joint effort on the parts of doctors Karen Boulanger and Shelley Campo, and these are public health related, behavioral scientists related, and massage therapy related investigators. And so, the social cognitive theory is a theory that's used a lot in public health, in health behaviors and promotion, in rehabilitation, and it's essentially looking at three main factors: behavior, personal factors, and the environment. And the theory basically says that all of these different pieces interact, and if you change something in one, all of the rest of it changes, okay? So what they do is they use the social cognitive theory as a model for the investigation that they want to see. They want to know if, like in other professions, practitioners' beliefs about their effectiveness and beliefs in their care affect what they're actually doing in their practice. So here they have three personal factors that they're looking at for the massage therapist. They're looking at the outcome expectations, so how much the practitioners anticipate that their treatments are effective and good for pain, depression, anxiety, and the like, those sorts of things. Also, the expectancies, which is basically the value that is placed on a particular outcome. So how important is it that this occurs, okay, or XYZ occurs? And then also their practice experience. And for their purposes, they're using how long it's been since they've had their primary training in massage. And then they're also looking at their practice environment. So whether working in a spa, whether they're working in a chiropractor's office, whether they're working by themselves or with other practitioners, influences how they behave in their practice, okay? So they are also looking at the frequency of three particular behaviors. So behaviors in a clinical sense, so what they're doing in their practice, whether or not they're assessing the muscles for tautness or
injury or
injury, right. And then also the sorts of things that they do in their practice regarding education, so how they educate their clients in nutrition, how they educate their clients in other aspects of their health.
Stretching, self-care,
right,
water drinking.
And then also their interventional behaviors that are interpersonal related. So how much do they feel like they have to be a friend to their client? How much do they feel like they have to listen to the other problems or talk about their personal lives or things like that? So those were some of the pieces that they were asking about and seeing if these things were affected by some of these other personal factors. That was a big mouthful, Michael. I'm sorry.
No, I think I'm getting it. So, so again, I wrote down the three things you mentioned, which is clinical behaviors, kind of how they approach in a clinical sense, how they educate their clients, and how they communicate to their clients, or how they connect with their clients in terms of information they share and what kind of a relationship they have with their clients. Did I get that right so far?
Yes, yeah.
Okay.
And so what they did with this is, so how do you measure that? How would one find these sorts of things out? Right?
To measure at first hearing.
Yeah. So they did a really nice survey design. They did. So this was done in Iowa. Is that right, Ruth?
Yes.
Iowa. Yes.
Oh, yeah. See, it was done by mail. A survey by mail. Looks like.
In Iowa. And so what they did was they got a list, which is public domain knowledge of all the different massage practitioners, those who were licensed, those who weren't under any kind of investigation or what have you. And then they did a random number generator and sampled 500 of the 2,000 plus licensed therapists in the state, and they sent them a mail survey, and they invited them to participate. It was a 4-page survey that collected the specific data. And then they, after a certain amount of time, if they didn't hear back from them, then they gave them a call and asked them to participate. And so they actually got a pretty good result back.
Yeah, so
they got
40%.
So 40%.
That's phenomenal for a survey, at least in the marketing world.
Well, it was an exhaustive survey. I saw that survey when it was in development, and it was, 4 pages of, you have to think hard about some of those answers.
Yeah, it's a pretty good response.
Absolutely. So they did a really nice job of identifying really good methods to get a robust return on this. So they had all of this information. They got Likert scales, and they asked them, how much do you agree or disagree with this, or where do you fall on this spectrum? How often do you practice this sort of behavior in your practice? So this is how they were collecting the information. And this particular article is very theoretically driven. It's also very statistically driven. And so I'll talk a little bit about that in just a moment. But let's see, they actually give the theory-driven research question in the study is very clearly defined. Are personal factors of the massage therapist, outcomes, expectations, expectancies, and practice experience, and the practice environment associated with the frequency of various behaviors? Okay, so
those three things we identified. The behaviors are those three things that we identified earlier.
Yes.
Right. Clinical behaviors, what you choose to do.
Okay.
How you choose to, what you want to educate your clients on, and how you conduct your interpersonal relationship with that client.
Okay, got it.
Right. All right. So the first thing that they did, they had all of this data, and now they have to devise what their models are going to be. And so there's several steps that have to be done before they get to sort of the big takeaway pieces, which were the regression analysis, if you will. And they did a really Ruth is holding her head. And so basically the first thing they had to do was they looked to see how associated some of these things were. So they did correlations with these pieces so that they could see, yes, these are things to combine. They did some multivariate analysis. Don't hold your head too much here. But it's basically what they did. It's a statistical test that you can do, that you plug all these different variables in, and SPSS, which is what they use, magically puts together all the things that relate to one another. And then it sort of throws out the variables that don't fit. And so they were able to identify 3 key pieces, and this was the clinical aspect, the educational aspect, and the interpersonal aspect. And then they were able to identify from those 3 main pieces which of the questions loaded, which is a statistical term, loaded under each one of those factors. Okay, so this was their principal component analysis, and then they did some exploratory factor analysis. Let all that wash over you. It's all good. So they said, yes, wash it over. So, but when they're doing the reporting of this, they're also giving you the mean answers. So what the mean response for all of these 151 folks, and lets you know how much they value different pieces, for example, or how much they do something. In the case of the table 2. And so, for example, one of the things they say is assess my client's muscles to understand their condition, that's something that's really valuable. And for that piece, the mean response out of 7 was 6.6. So everybody thought that that was something that they value very much in their practice. And then you scoot down a little bit more and you're looking at the interpersonal, and act like a friend to my clients scored a 4.2 on a mean, with 7 as the highest. So that lets you know that that's not as high up on the important scale for practitioners. And then I don't know about you, Ruth, but this is one that made made me cringe a little bit from my former massage education days. Share personal aspects of my life with my clients.
How important is it to do that, Niki?
Right. How important do massage therapists feel that is? Well, that scored one of the lowest, 2.7.
Isn't that good?
That is good. I was always taught, you don't share a whole bunch of personal things about
unless
yourself.
you're on Facebook.
Yeah, oh, well, that's a whole. We could have a whole session on do you friend your clients, but we won't go there. So anyway, a lot of interesting pieces that when you're looking at some of these very statistically driven tables that make you want to hold your head sometimes, you're getting some of this information out of them, which was really nice. So once they established these different pieces, they then built the models for the regression analysis to determine if these different pieces were significantly related. And basically, the long and the short of it is that there were some pieces. The practitioner experience level wasn't something that significantly affected much. It did affect, clinical behavior. So how they performed in their clinical behavior, probably with confidence or something like that, they speculate made a difference there. But like whether or not they practiced with others or in other settings, that didn't have any effect on how they did their clinical behaviors, their educational behaviors, or their interpersonal behaviors. But that the way that they valued pieces, so how important things were to them, that predicted every time how often they did particular clinical behaviors, how often they educated their clients and performed those kind of behaviors.
How much they valued what? I'm sorry?
How much they valued particular components or outcomes. So if somebody valued the clinical behaviors, then it accurately predicted how often they did those clinical behaviors.
Like if you think stretching is just, or a particular kind of stretching is just really tremendously effective, then you do it more often. It's not a huge surprise.
That's what I'm thinking, yes.
Outcomes, but something I'd like to add, and Niki, you can cut me off if it's too soon to talk about this, but the truth is what this team found out was not a huge surprise, right? About when we value something higher, we do it more often. They got some nice data about what people thought was really important. And they found that massage therapists in general are pretty optimistic that what they do will have a positive outcome. And, that's good news. But oh shoot! Now this is the theme of today. I just lost my train of thought. Take over.
Well, I think where you were going with this was that while these outcomes may be rather obvious and maybe okay, well that makes a lot of sense. It's never been documented for massage therapists and massage practitioners, and it has been documented in primary care. It's been documented in other health-related areas, and so
nursing I've seen this.
Absolutely. And so being able to sort of catch our field up with these pieces, yes, it may be obvious, but now here we have it documented. It's theoretically driven. It's very methodologically sound, the way that they did this. It's something that a lot of other pieces can point to say, this gives us foundation to look further into this. Now, the next question that can be asked, and which they discuss quite a bit, this is a cross-sectional study of just massage therapists. This doesn't have anything to do with actual outcomes. And so now, how can we look at what their expectations are, what massage therapists' expectations are, in relation to what the actual client or patient outcomes are? Oh, hello, puppy.
Your dog agrees. Ruth's dog agrees. Well, Niki, I love what you're saying, because at first, yes, you are correct. Well, this seems like a very obvious kind of result here. This makes sense. Not that it's bad, but it just makes sense. And so I'm kind of wondering, well, what is the value in doing this? Why was this conducted? And now I understand that it's not about proving some dramatic revelation or anything. It's more about creating a foundation for the profession, which I think is really important, because that really is kind of a commentary on why we have massage therapy research happening right now. Because I know a lot of massage therapists, not all of them, but a lot of massage therapists really desire to have respect in the medical community. And until the research foundation is there to, as you said, Niki, catch the profession up with other medical professions, that's going to be a challenge, I think. Would you agree?
Well, it certainly could be. And I think that what this particular team has done really nicely is some of the questions that have been asked as far as how practitioners practice and their practice behaviors, what influences that and affects that in these other fields, being able to say, the same holds true in our field as well.
Yeah.
And so from an educational standpoint, there's a lot of pieces that apply here. So if indeed the evidence shows, research evidence or clinical experience shows that these sorts of outcomes, that these sorts of behaviors are really important, making sure that massage therapists, whether it's in their foundation training or in the continuing education training, that these things are emphasized, that these pieces are getting out to therapists so that they know how important it is. It brings their value and opinion up of how important it is for their clients. Then they will implement it and they will practice it in their behavior, their intervention behaviors.
Well, yeah, I think there are more applications for it. We're at such an interesting time in our profession with the entry-level assessment project, looking at what it takes to launch a beginning massage therapist and have to create a sort of baseline of educational foundation. And of course, the Alliance for Massage Therapy Education is working on their standard criteria for teacher preparation and educator preparation. And so to have some information like this about really how massage therapists sort of use and apply their skills in these settings is really, really interesting. And something came up that I'd love to speak to, because this is a conversation I get into a lot. Niki pointed out that one of the things that didn't seem to matter very much in terms of making a difference in how people structured or prioritized their activities was the setting. So if someone was working in a spa or in a clinic or individually or making home visits or doing whatever, their priorities and their expectations were more or less the same across that spectrum, right? That's fair. And the reason that really caught me is that I am frequently drawn into conversations about tiered credentialing and whether or when it might be the right time for the profession of massage therapy to think about, a different credential for someone who wants to work, say, in a recreational setting as opposed to in a clinical setting. And this is a sticky question for everybody. And hearing what you just, hearing what Dr. Boulanger and her writing partner found out, which is that people don't behave differently, they don't make different decisions in these different kinds of settings, is a piece of information that should really be incorporated into a profession-wide discussion about that. I always get
their main piece that they were looking at was practices with others too. That was the main piece. Solo practice versus non-solo practice.
Group practice, yeah.
Right. And so a real close look at the particular settings wasn't one of the pieces of this, but you can do some assumptions here that solo versus group.
We can extrapolate.
We can. And the group settings did include chiropractor, spas, et cetera, et cetera. Yeah. Mm-hmm.
Right. So I just think that it's subtle and it's complicated. and maybe this is among the things we've talked about on Research Perch. It's not one of the ones that have a takeaway that you can go and apply to your practice tomorrow. But in terms of using research to advance our profession, this is going to end up being quite an important piece.
Yeah, I think that makes a lot more sense to me now, so I appreciate that. And I also like the last line here. I want to kind of be sure we kind of wrap up with this, because I love the last sentence of this abstract. It says, the massage therapists were optimistic regarding the ability of massage to provide a favorable outcome, especially if the desired outcome was supported by research.
Right.
So I like that because obviously research matters to massage therapists more and more, I think. So I really appreciate that being stated so clearly.
Mm-hmm.
So. Yeah, well, and they also do a really nice job of saying, there are some limitations to this particular study. This was just a sample of Iowa massage therapists. Now, Iowa is a little unique in that they've required licensing for over 20 years. They have pretty stringent criteria. They were able to show that their sample was representative of the folks in Iowa that are practicing. So they looked at those pieces, and they do make a call that the next step for this would be to look at it on a larger scale, a national study, and see if the same kind of results apply.
All right. Well, thank you, Niki. I appreciate your insight. Thank you, Ruth, as well. Great discussion today. So really appreciate your time. So again, thanks so much for watching or listening. If you're listening, thanks so much. We appreciate you taking with us as you drive, go to the gym, go for a run, do laundry, wherever we can be with you. And if you're watching, thanks so much. You can also click below to take this with you on your iPhone or Android device. Again, these articles come from the International Journal of Therapeutic Massage and Bodywork, which is at ijtmb.org. Please be sure you're subscribed. And there's a lot more where that came from. So again, thank you both today. Really appreciate the discussion, and thanks everyone for joining us today. We'll see you next time.
See you soon.
Bye-bye.
Thank you for joining us for this episode of Research Perch. Please send feedback or questions to perch@massagetherapyfoundation.org. See you next time.